Welcome to another episode of This Month in Health. I'm Liz Ortiz. This month, September, is Ovarian Cancer Awareness Month. It aims to promote early detection and support research and care for those affected. This year alone, the American Cancer Society estimates about 20,890 women will be diagnosed with ovarian cancer. Sadly, about 12,730 women will die from the disease. Joining me now to talk more about the importance of ovarian cancer awareness is Dr. Alvarez Secord, professor of obstetrics and gynecology at Duke University. Dr. Secord, thank you so much for your time and for joining me today.
Oh, thank you so much for having me and for allowing us to have a conversation about ovarian cancer.
Yeah, it's such an important topic. I want to start just the basics. What is ovarian cancer and how does it differ from other gynecologic cancers?
So, ovarian cancer is a very unique. There's some fascinating terminology changes about ovarian cancer that I think are kind of hard to recognize and can cause some confusion. So, I appreciate the opportunity to talk about this more. So, the ovaries are these really tiny little organs, about the size of a walnut, actually. And the ovarian cancer can actually come either from this outer part of the ovary called the epithelium or the inner part called the germ cells. There's also another component of the ovary called this connective tissue, where you can get cancers from any of these different tissues. But the most common one we see is the epithelial ovarian cancer. And just recently, it was identified that some of these cancers are actually coming from the fallopian tube, and the ovary is just kind of gets blamed for it. But that accounts for some of the times patients may get confused because they hear you have ovarian cancer or you have tubal cancer. And then there's this other rare cancer called primary peritoneal cancer that actually is very similar to ovarian cancer. So I know that's a very long answer to your question, but ovarian cancer can actually represent all three of these cancers.
Wow, good to know. I didn't know that myself. So I mentioned the numbers in the beginning of how many women will be diagnosed this year. How common is it really? Can you put it more into perspective, how many women this affects really each year?
So you mentioned that data in terms of the absolute numbers, but on a case by case basis, about 1 in 91 women will be diagnosed with ovarian cancer. That's 1 in 91. So it's not a very common disease. However, it's the most lethal gynecologic cancer. 1 in 143 women will die of this type of cancer.
Wow. And talk about who it primarily affects. Do you see it more in certain groups or demographics than others?
Well, epithelial ovarian cancer tends to happen in women that are older. The median age of diagnosis is typically in the 60s. So it's something that's not commonly seen in younger women or women before menopause. But there are certain individuals that are at higher risk where you may see these types of cancers occur earlier. So especially those patients who have a strong family history or patients who have a mutation in certain types of genes.
Good to know. And are there different types or stages of ovarian cancer? Can you walk us through that?
Absolutely. So there's four different types of stages of ovarian cancer. Now, stage one, when you're talking about any type of cancer, that's usually going to be localized to the ovaries and not have spread elsewhere. Stage two, you start to get spread elsewhere in the pelvic area. Stage three, that means it's spread up into the upper abdomen. And then stage four is more distant spread. So spread to the lungs, or if there's fluid in the lungs, that's positive for cancer cells. Or if you have an actual mass of this type of cancer in the liver or the spleen.
Wow. And I was reading just in doing some research about ovarian cancer that it's often referred to as the silent killer. It seems as though in the earlier stages there aren't any symptoms, at least little to no symptoms. Is that correct? And can you expand on why it's referred to as the silent killer?
Yes, I'm so glad you brought that up. So, one of the things that's so challenging with ovarian cancer is even if it's spread into the advanced stages, like stage three or four, people may not have a lot of symptoms, or they may have symptoms, but they're so subtle. So, even if there's these symptoms, because they're so subtle, there's this terminology of silent killer. But some women do have these symptoms of abdominal or pelvic pain, a little nagging there or here, some changes in their bowel habits, or maybe bladder changes, or they may feel full earlier, or their abdomen or the pelvic area has just gotten a little bit bigger. So there's symptoms there, but they're just not really definitive or strong. And because of that, it often leads to a delay in diagnosis, even up to 6 months.
And I'm sure you've heard this from even your own patients. They might feel these things, but it's easy for us as women to maybe pass it off as something else. You know, maybe my hormones are just out of whack today, maybe digestive issues, something like that.
I absolutely agree. Being an individual who is a female as well, I've had these symptoms on and off. And the key, though, if you have these symptoms daily for 2 weeks or more, then you should contact your provider.
And would you say that the understanding of ovarian cancer has changed over the years? Do you find that more women are aware of this or paying attention to this? What would you say when it comes to
Oh,
ovarian cancer?
I hope so. We're really trying to get the word out there. I just think sometimes it's hard for people to talk about these cancers that are under the belt. And ovarian cancer is a little bit under the belt. So there may see some stigma in having those conversations. But there's been wonderful enhanced communication across the country through a variety of different groups. And here in our own area, there's the Gail Parkins Awareness Event that is led by Melanie Batchelor. That's just been a wonderful opportunity to get the community more engaged and also provide education to our community.
And again, that education is so important. You mentioned the stigma. Why do you think that is? And when you have your conversations with patients, how do you sort of encourage them to maybe advocate for themselves, to pay attention to these things and not ignore them?
Yes, absolutely. So important. Well, I think one of the most important things is just as providers, we should listen. And the patient can often tell us what's wrong. People are very acutely aware of what's going on with their bodies. So sometimes they'll have this nagging suspicion something may be occurring. But with ovarian cancer, it's tough. Like we mentioned, these symptoms are so subtle. So if there's concerns, just continue to advocate for yourself. Ask for additional testing. Ask for a pelvic ultrasound or a CT scan. Now, the most important thing though is understanding these are symptoms that are not getting better. You're having them daily for every 2 weeks. If you just have a few of these symptoms and it comes and goes, it's probably nothing that you need to be worried about. But if you're having them persistently and they're not getting better, that's time to advocate for yourself and to call your primary care provider. A lot of times people forget a very important element of the exam is a pelvic exam. And those aren't always comfortable to have, but they can actually provide a lot of information.
And I'm curious, is there a genetic component at all when it comes to ovarian cancer?
Excellent question. I alluded to this just a little bit at the beginning where we talked about somebody may have a strong family history or genes
Yeah.
that predispose them to these cancers. And you're absolutely correct. There are these certain types of genes. The most common ones we hear about are BRCA1 or 2. So some individuals inherit these mutations. It doesn't matter if you inherit it from your mom or your dad. If you have the mutation, you're at higher risk for these types of cancers. For someone who has a BRCA1 gene, it could be anywhere from 40 to 60%. For BRCA2, it's lower, around the 20% range. And then there's this whole host of other genes that we're now recognizing that are also important. Another very common gene abnormality we may see is something called Lynch syndrome, which are genetic mutations in this mismatch repair genes. And those patients are also at higher risk. So important to understand your family history, to make sure your provider is aware of your family history, and if you should have this screening done to see if you have one of these mutations. If you have this mutation, please talk to your primary care provider about it. There are things that you can do for screening to prevent these cancers. And for ovarian, tubal, and peritoneal cancers, one of the things that we can do is remove those fallopian tubes, may reduce that risk of having these cancers. So if you're having surgery for another reason, maybe it's time to talk to your surgeon about, should I have my tubes removed? And for patients who have these genetic or predispositions to these cancers, also see a specialist. Have a conversation about risk reducing surgeries to remove the ovaries and the tubes to prevent these cancers from happening.
And I'm sure you would encourage your patients to talk with their families, as you mentioned, to know what their family history is.
Absolutely. It's so important. It's something, even in my family, being a physician, I don't think my own family members understand some of the important elements of, it doesn't matter where this gene comes from. It doesn't mean that you have to have the gene coming from your mom's side to have a higher risk of breast cancer. If it comes from either side, it could be important. And some of these cancers that you have to look for would be prostate cancer or colorectal cancer, not necessarily just ovarian or uterine cancer. And another really common one, is breast cancer.
All important information. All right, Dr. Alvarez Secord, we're going to pause right there. We're going to take a quick break, but when we come back, we'll talk more about early detection, symptoms, and risk factors. Stay with us.
Thank you.
Welcome back to This Month in Health. I am talking to Dr. Alvarez Secord about Ovarian Cancer Awareness Month. So, Dr. Alvarez Secord, I want to jump back into the conversation about ovarian cancer. Talk about some of the most common symptoms. I know we touched on this a bit before, but what are some of the common symptoms and when could they start to present?
So when these symptoms start to present is typically when individuals have more advanced stages. Early detection of ovarian cancer is very challenging because these ovaries are just so tiny. So you can have a mass that develops before somebody even feels any symptoms whatsoever. But I would say the most common things I see are just feeling full early. So another word for that is bloated. Like patients will say they just feel fuller than they used to, or they may feel like they're not as hungry, like they, eat less than they used to before and start to feel like their tummy is getting fuller. Other symptoms are bowel changes. Most commonly, I would say we see constipation compared to other types of bowel changes. Abdominal pain, pelvic pain, changes with their bladder function. So they may have a lot more frequency than they used to have. And again, these symptoms should really be like a daily occurring, at least 2 weeks, to really instigate any alarm, just because some of these symptoms are things that women experience on occasional basis.
That's what I was going to say. Those are some of the symptoms, as I mentioned before, that we could feel as women, but we'll just kind of ignore that, and then it might pass.
Yeah. And then I would say it's very rare that someone will come and say they actually felt something like a mass in their pelvic area. But I have had that before where people present that way. But the most common, like I said, is just they're subtle symptoms, but they're, like the bloating and feeling full and abdominal aches and pains.
So you mentioned that 2-week time frame, if it extends that long. So is that the point when women should say, I got to get to my doctor?
Yes, absolutely. If you actually feel a mass there, that would be a point to get to your doctor because the mass is not normal, But the other ones, they, can come and go. And if this is kind of something that you've experienced intermittently on and off, don't be alarmed. But if this is a new symptom and it's just not getting better, that would be concerning. Now, even later symptoms that people may have would be weight loss. Or night sweats, but those are typically later along, and more often I would say people present before we get to that stage. And a very rare one, but sometimes I see, is where people will have short of breath, and that's because they've had some fluid accumulate around their lungs. But typically that's going to be picked up by a chest x-ray that somebody gets that complaint and orders that scan and takes a peek of that and then realizes, oh, something's not right.
So when a woman, she goes to the doctor, talks about these symptoms, what are some of the ways in which you as the doctor would be able to figure out something isn't right with the ovaries?
Well, the thing I always do, and I'm a gynecologist, so clearly the pelvic exam is part of what I do for my examination. A lot of times, though, people aren't always comfortable having a pelvic exam or having their physician do a pelvic exam, but that's a really important part of the evaluation because a mass can be felt. Things on that exam may elicit further study. But if a pelvic exam is not done, other exams that we typically will order will be a pelvic ultrasound or a CT scan. It really depends on the examination findings in concert with the symptoms that someone has. Very rarely will someone have a pelvic MRI because typically we're able to determine what needs to be done with the next steps based on the ultrasound. But sometimes we want to do an additional radiologic imaging of the pelvis. It may be an MRI. And then blood tests can be very helpful. There's 2 blood tests that I use a lot, and that's the CA-125, which is a marker for ovarian cancer, but it's pretty nonspecific, so it can be elevated for a lot of different reasons. And because of that, I'll sometimes add another marker called HE4, and HE4 can be more specific. And it can also help in terms of, if you're seeing a doctor who's not a GYN oncologist and they're trying to decide on your surgery or where to have surgery, by having both of those tests together, it can identify somebody who is more likely to have ovarian cancer.
And I know we spoke about the family history, the gene mutations. Are there any other specific risk factors that would increase a woman's likelihood of ovarian cancer?
Well, there's many different risk factors we can talk about. There's been a lot of comment about talc, for instance, and that is somewhat controversial. We really don't know the answer to that yet. I can also share that women who are nulliparous or nulligravid, who haven't had pregnancies before, are at higher risk, and that may be due to this idea of incessant ovulation, which means that your ovaries are constantly working to produce this egg. And that goes along with polycystic ovarian syndrome. And that's just to name a few things. But polycystic ovarian syndrome is actually pretty common. And while those people are at increased risk, I would say don't worry. That doesn't necessarily mean you're going to get ovarian cancer, but just to be aware of these symptoms. And patients who have endometriosis are also at a slightly increased risk. It's about 2 to 3 times increased. But again, even though that's increased, it's a very small amount because remember, this disease is actually pretty rare. 1 in 91 patients will get ovarian cancer.
Wow. All right, Dr. Alvarez Secord, we're going to take one more quick break, but when we come back, we're going to talk a little bit more about prevention, what women can do to maybe reduce their risks, and also some of the research that you mentioned. I know that you and also your partners in medicine are a part of, so we'll talk more about that when we come back.
Thank you.
Welcome back to This Month in Health. So, Dr. Alvarez Secord, we continue the conversation about Ovarian Cancer Awareness Month. Curious if there's anything women can do, whether it's lifestyle changes or otherwise, to sort of reduce or minimize their risk of ovarian cancer.
Yes, there's actually a few things. So one I thought is taking birth control pills can actually reduce your risk of ovarian cancer. One of my colleagues at Duke was really instrumental in this work. That's Dr. Gustavo Rodriguez and also Dr. Andrew Burchuk, who've been studying prevention of ovarian cancer. So that's something to talk to your doctors about. The other options are risk reducing procedures. We talked briefly about removing of the fallopian tubes, which is called a opportunistic salpingectomy, very fancy words there, or sometimes removing the ovaries and the fallopian tubes together. And my colleague at Duke, Dr. Haley Moss, is actually doing 2 studies on this. One is called the SOROC study, and the other is called the TUBO-WISP study for patients who are at higher risk for these types of cancers. And then the other ways that you can reduce the risk, or at least try to have increased identification of or prevention of these cancers, is by screening. Now, screening is really tricky because it may not necessarily work in terms of reducing, or I should say, improving survival outcomes. But there was one study that did show patients were diagnosed with earlier stages of cancers. And screening is typically done through CA-125. But a really interesting idea is, could you follow the CA-125 over time and look at trends, and with a transvaginal pelvic ultrasound?
And I'm curious, for those who are diagnosed, what treatment options are available? I know this can vary, depending on person to person, but is there sort of a general treatment for those who are diagnosed?
Yeah, so absolutely. Surgery is a hallmark of care for patients who have stage 2 through 4 disease. Treatment includes surgery and chemotherapy, and the order of that can be different. Like sometimes we'll do chemotherapy first, followed by surgery, and then more chemotherapy. And the backbone of chemotherapy are these 2 drugs called paclitaxel and carboplatin. You can treat this chemotherapy can be delivered by IV, so intravenously. There's also a lot of interest in belly wash therapy, or even heated belly wash therapy, which is undergoing clinical trials. And then there's a lot of new drugs out there. One drug that we've been using now for a while is PARP inhibitors for maintenance. That is definitely shown to improve disease control, and we're hopeful may actually lead to more cures. So we're really excited about that. And there's newer drugs being developed all the time. We have these antibody drug conjugates that are like heat-seeking missiles. So it's certainly an exciting time as we have more drugs in our armamentarium than ever before.
And of course, with Ovarian Cancer Awareness Month, really the whole point here is to raise awareness and education. How critical is early detection when it comes to survival rates with ovarian cancer?
Oh my gosh, absolutely critical. So patients who have stage 1 disease, their survival rates can be 90 plus percent. Stage 2, we're dropping into the 75% and higher survival outcomes. Stage 3 and 4, then the survival is not as good, and we need to do better. So, if you put those two together, it's like 25%. But we are seeing improvements, and we're definitely seeing improvements for patients who have the cancers that are associated with the BRCA1 or 2 mutation, where PARP inhibitors are making a difference. And as I mentioned, we have newer drugs coming on board all the time. So our hope really is that one day we'll be able to prevent all these cases altogether. And for our patients who do have ovarian cancer, we can really help control this disease. If we can achieve a cure or remission, that's wonderful. And if we can't, that we can continue to provide treatment options that will help them live better and longer lives every day.
Absolutely. That is 100% the hope. And for anyone watching who maybe their friend or family member or loved one is dealing with ovarian cancer, any advice for them and how they can support that loved one?
Oh, so important. The caregiver and family is so important. I would say, it's so important just to ask somebody, how are you doing? And let them know that you're there for them.
And I know you talked about a lot of exciting advancements when it comes to ovarian cancer research. Anything in particular that you want to highlight and where you hope to go in the future? I know we discussed this a bit.
Absolutely. Well, I love the whole area of novel therapies. And as I mentioned, these antibody drug conjugates, I'm really excited about. I see them as a heat seeking missile. They have these antibodies that can target onto these abnormal proteins on the cancer cell and then attach directly to the cancer cell and then inject the chemotherapy drug to try to kill that cancer cell. So it's a really exciting time, but newer drugs are being developed every day. So we're just happy that we can reach out to our community and provide care for them and access to clinical trials.
Absolutely. And for any women or who want to look up, just resources or information about ovarian cancer, any trusted sources that you would suggest when it comes to looking up information? Because, there's so much information that may not be exactly the truth. What are the trusted sources that you would suggest?
Well, the Foundation for Women's Cancer is a great site. It has wonderful educational resources for patients. There's a lot of educational material, both online as well as pamphlets. And they also have a resource for patients to be able to find doctors throughout the country. So it's Foundation for Women's Cancer. And I'm happy to share that website with you.
Perfect. And Dr. Alvarez Secord, that's all I have. Any final message or any final information you would like to get out to listeners about Ovarian Cancer Awareness Month? Anything they should know, anything they can do?
Oh, I want to share that we have this wonderful ovarian cancer awareness event called the Gail Parkins event. And it is led and was developed by her daughter, Mel Batchelor. It is the 23rd year of the event, and they have 75 teams this year. And we are so thankful every time we get to have this event. Survivors and their families can come and share their stories. There's also an educational session where we can share some of the latest developments that are ongoing in ovarian cancer research. So we hope to see everyone there for the run and walk. And it is on September 20th.
Oh, great. Yeah, we'll make sure to link that information. Well, Dr. Alvarez Secord, thank you so much for talking to us about Ovarian Cancer Awareness Month. We just hope one piece of information will help someone or a loved one. So we appreciate your time today.
Absolutely. So happy to be here.
All right. And that'll do it for this episode of This Month in Health. I'm Liz Ortiz.